I know we still have some participants joining us, but in the interest of time, I'm going to go ahead and get started. So, hello and welcome everyone to our latest installment of AFTO's fall webinar series. I'm your host, Carrie Rigdon. We have a really hot topic for you today, judging by the great registration numbers. Today, we're featuring the latest hand washing protocols and applications for food preparation in circumstances where there might be limited water availability. We've got two excellent speakers with us today. But first, a little housekeeping. So, this session is being recorded, and all those who registered will receive a link to the recording as well as a copy of the slide deck. I was going to say next week, but with the holidays, it might be that first week in December, but you will get it in your inbox. If you have any questions for our speakers, please leave them in the Q&A box, and we'll address them during the question and answer portion at the end of our session. We ask that you use the Q&A tool instead of the chat. That makes it easier for us to see the questions. Also, if you'd like to ask questions verbally during the Q&A, please use the raise hand feature at the bottom of the Zoom screen and we'll prompt you to unmute. And we'll give you a reminder when we get to that part. So now it's my pleasure to introduce our speakers. First, we have Jim Arbogast. He's a scientist who entered the world of product development after getting his BA in chemistry from Carleton College, followed by earning a PhD in organic chemistry from UCLA. Dr. Arbogast has worked at Clorox, Dial, and Gojo, where he has formulated hundreds of consumer products and made many contributions as a hygiene science ambassador, most recently for Purell Solutions. He's made numerous presentations at a wide variety of scientific conferences, been part of multiple popular press articles, has been an inventor on over 70 patents, and co-authored over 50 peer-reviewed publications. All of those are driven by his passion for educating on public health topics, advancing hygiene science, and improving policies and practices in the spirit of reducing food safety risk and infection prevention. Joining Jim is Dr. Donald W. Schaffner. He's an extension specialist in food science and distinguished professor at Rutgers University. He is the current chair of the Rutgers Department of Food Science, and his research interests include hand washing, cross-contamination, and quantitative microbial risk assessment. He's a fellow of the Institute of Food Technologists, the American Academy of Microbiology, the International Association for Food Protection, or IAFP, and the Society for Risk Analysis. Dr. Schaffner was a president of IAFP in 2013 to 14, and he co-hosts the Food Safety Talk and Risky or Not podcasts. So now I'd like to turn it over to Jim and Don.
Okay, thank you for that kind introduction, Carrie. I'm going to share the screen right now. And all right. Hopefully you're seeing that. You see that, Carrie?
Yes, yep,
Okay.
now it looks great.
Okay, super. I'm going to jump in here and thank you for the nice introduction. When you get the slide deck, you'll have this written down about Don with this awesome picture. And then my formal picture here with the info that Carrie mentioned. I'm really biased towards advancing the science, action, and collaboration. So afterwards, if anyone wants to collaborate, talk about this study or other studies, I'm happy to speak with you. We'll have our contact info at the end of this. So we've already done introductions. I've got a little bit of background on healthcare hand hygiene guidance that is some important context. And then Don will cover the food code as it's currently written for hand hygiene and some recent evidence that from a study, a literature review that he's a co-author on. And then I'll get into the new study results, and we just have 2 slides on conclusions. I'm going to be going fast because we're trying to leave 10 to 15 minutes for questions and discussions. We're also trying to give you 5 or 10 minutes before the hour. So our objective today is to better understand germ reduction from hand hygiene, in particular hand washing relative to alcohol-based hand sanitizing. Our purpose is educational, trying to help you assess your products, how you think about hand hygiene, your intervention practices and guidance. Even more wisely, I'm sure many of you know, a lot about hand hygiene already. We're going to dive into some of the science. And it's concise. Clearly, we've got 35 minutes of content, so we could go for hours or days on hand hygiene, but we're going to hit the highlights here. So first of all, some definitions. What is hand hygiene? Well, it's really the practice of doing something with your hands, cleaning them or gloving to prevent the spread of pathogens. Pathogenic microorganisms is the fancy way of saying what we commonly say in the US is germs. And we're trying to prevent those germs from causing disease in humans in particular. Hand washing is the act of cleaning your hands with soap and running water and drying them afterwards, often with a paper towel if you're out in public settings, especially. You use a formulated cleanser to lift the soils. It's usually containing surfactants, surface active agents to lift the soils and germs off the skin. If it's an antibacterial hand wash, that's formulated with an active ingredient that's regulated by the FDA as an over-the-counter drug, and that active ingredient is intended to kill germs. Fun fact for you, the formulation matters, and that active ingredient isn't always active against germs, so the formulation really matters. Gloving makes a lot of sense in certain situations, in food service, at key moments, for instance, handling raw chicken or raw beef, that would be a good time to wear clean gloves. And you're trying to prevent the skin from contaminating other surfaces. And then lastly on this slide, alcohol-based hand rub. We'll use the acronym ABHR for that. Also, if you see the HH, that's hand hygiene. The HW, that's hand washing. In the US, we call that hand sanitizer. The rest of the world typically calls this an alcohol-based hand rub. It's formulated liquid, gel, or foam product. The format doesn't matter to killing germs as long as you've got enough alcohol in there. It's typically above 60%. The US rule is 60 to 95% to be compliant with the OTC monograph from the FDA. And it really rapidly kills a broad spectrum of germs, all bacteria and all envelope viruses. Okay, so in healthcare, in the 1900s, especially 1950 to 2000 or so, everyone, the guidance was hand wash. And some thought leaders were frustrated at the time, many of them were in the US and Europe, that hand washing compliance was very low. And there were a lot of legitimate excuses for that. It takes so much time relative to patient care, et cetera. Evidence started developing in the 1980s, I would say 70s, 80s, 90s. There's actually publications way back in the 40s where alcohol was used in surgical. But anyway, alcohol-based hand rub was, all the evidence was reviewed, and the CDC put out the guidance for healthcare hand hygiene in 2002. Key points of that are that it's superior and preferred to hand washing in many factors, germ reduction overall, and skin care. Hand washing can be damaging to skin if it's not formulated well, or if you have to wash often, like healthcare workers and food service professionals do. They said hand washing is good when, and should be done when hands are visibly soiled. It set the stage for a lot of important educational materials and collaboration amongst agencies. I've got those listed at the bottom. It pushed out what is often called bulk soap. These are these open refillable dispensers. So those are not allowed in US healthcare. You won't see those in hospitals. And it dealt with some of the concerns in the early 2000s, late 90s. There was some concern about flammability of alcohol, but really that's not an issue when it's managed well. Skin irritation is not an issue when it's formulated well. And we'll talk later. We'll talk more about the efficacy in a few minutes. The WHO, World Health Organization, built on that 2002 US CDC guidance and issued their own healthcare hand hygiene guidance in 2009. Got a link to that here. And I've just got one key point here. They created what they call a multimodal strategy. System change, you must have alcohol-based hand rubs. And remember, WHO is thinking globally. So in most developed parts of the world, alcohol-based hand rubs are available. pretty easily, but in developing countries, it's harder to get clean water, soap, alcohol-based hand rubs. So must have the right products, the right tools, basically. Healthcare workers, and really anyone needs to be trained and educated around hygiene. Evaluation of their performance of hand hygiene and feedback needs to be provided. They came up with this fourth pillar of the multimodal strategy, reminders in the workplace, which is often posters on the wall, but you need to make sure you're changing those posters, screensavers about hand hygiene, just ways to bring hand hygiene to mind. And then lastly, and probably most importantly, they found, and there's hundreds, maybe thousands of publications to support these, that you must have a climate, a culture that supports safety and hand hygiene. So in 2012, I collaborated with a few professors, Angie Frazier from Clemson's the lead author on this, Leanne Jacobs and Richard Linton. And then we had Didier Pate, who's the infectious disease doctor that's the lead author on the WHO guidance, and the second author with Dr. Boyce on the CDC guidance. So we're looking at and asking really people to think about hand hygiene and food service in a different way. And I'm just going to prompt or summarize a few key points from that. The hygiene guidance is from the healthcare side of the fence, so to speak, is a good resource, and it can inform food code improvements and food safety practices. Alcohol-based hand rubs should be studied as a replacement. This was 2012. This still exists, though, and really not much has changed since then in food service hand hygiene. Alcohol-based hand rub works when hands are not heavily soiled. Don will talk more about that. And you want to be careful not to be in situations where you're going to have exposure to parasites or spores, because alcohol won't work on those. But in food service settings, that's really pretty rare. And it can be used, alcohol-based hand rubs, in less risky situations. Is a good way to rapidly reduce germs on hands. Got a couple examples there. Current indications in the food code, when to wash hands, are far too many to be practical for food handlers. Don will hit a little bit on that. And then this guidance, this paper, I should say, prompts that a risk-based approach to hand hygiene would make a lot of sense and strongly recommended, with emphasis on the highest risk moments, cleaning hands at those highest risk moments and being compliant with that. And now I'm going to turn it over to you, Don.
Thanks, Jim. I know from past experience that I talk at about 2 minutes per slide, but if I do that now, that is going to put us seriously behind. So I'm going to try to move through my portion of the slide deck relatively quickly here. So first thing we're going to talk about is what the FDA model code says about hand hygiene. And I know I'm looking at the attendees list, and I know there's folks in that list that know the code better than I do, but I'm going to do my best to tell you at least what the way that I read the code and what I think is important. So first of all, the code says how to wash, and there's two bits of quantitative information in this how to wash. The first is, and it's in that first bullet point A, you need to wash your hands for at least 20 seconds. Now, to be a little bit confusing, perhaps later on under B3, it also says that as part of that 20-second hand wash, you need to rub together vigorously for at least 10 to 15 seconds. Now, don't get me started on why saying 10 to 15, it's like a critical limit, that you never give a critical limit that's a range. So is it 10 seconds? Is it 15 seconds? Well, the code says 10 to 15, whatever that means. So, but again, the idea here is that you want to do more than what my former graduate student in this area called the splash and dash. Next slide. Also, the code says when to wash. And I think this is actually much more interesting to me than the how to wash. And basically, you can read it there on the right-hand side, but I've distilled this down. And we're going to come back to this when we talk about the article that I wrote with John Boyce. But basically, you should wash your hands whenever your hands have touched bare body parts other than clean hands and clean exposed portions of the arm. So if I do this, now, according to the code, I have to wash my hands. After using the toilet, I think that's obvious. I don't think anybody's going to dispute that. After touching animals, well, you shouldn't have animals in the kitchen, hopefully. After coughing, okay, makes sense. Soiled equipment probably makes sense. To prevent cross-contamination, well, that would require you to know that there's some cross-contamination going on. When switching from between raw and ready-to-eat foods, that kind of makes sense. And then also, this one doesn't necessarily make sense to me, but before putting on gloves. So those are all times when the food code would indicate that you must wash your hands. Again, more on what this burden actually means to food service employees in just a minute. Next slide, please. Okay, we are also in this presentation talking about hand antiseptics. That's what Jim talked about, what these things are called in different places around the world. What the FDA model code calls these are hand antiseptics. A hand antiseptic is a hand antiseptic used as a topical application, a hand antiseptic solution used as a hand dip, or a hand antiseptic. And then it also talks about antiseptic soap, which is really a separate discussion. But really the key point here is that you're only allowed to use hand antiseptics on hands that have already been washed. And you can see that recommendation is already different from the Boyce and Pate article from MMWR that Jim talked about earlier. Next slide, please. Okay. So I want to talk a little bit about how, and again, there's many folks here in the attendees list who are familiar with the Conference for Food Protection and how that process works very slowly to modify the code. I've been part of a group of people that have tried for many years to get some movement or flexibility on the temperatures used for hand wash sinks. Now, the science would say, and certainly experience shows, that the most important thing is providing water that's at a temperature that is comfortable for the person to wash their hands. Again, we tried for quite some time now to get the code modified. The temperature, the wash water temperature in the code has been steadily moving downwards, but there still is a temperature. And right now, the current version of the code, which was in response to a CFP issue that didn't recommend exactly this, but it is, you take what you can get, right? Right now, you have to, the code says you will wash your hands at a hand washing sink, and this is part of the plumbing section of the code. That's why it's 5-202 and not one of the other sections. A hand wash sink shall be equipped to provide water at a temperature of at least 29.4 degrees C, which is 85 degrees Fahrenheit, through a mixing valve or combination faucet. So right now, if you're washing your hands in water that's at 84 degrees Fahrenheit, or at a sink that can only provide temperatures of 80 or 84, you're out of compliance with the code. What the literature says, and we published data that looked at 60 degrees Fahrenheit, 80 degrees Fahrenheit, and 100 degrees Fahrenheit, and what we found was there's no difference across a variety of subjects. There's a lot of person-to-person variability with respect to technique and how people wash their hands, but water temperature really doesn't matter. Obviously, if the water is boiling hot or if it's ice cold, that's not going to be comfortable. And you're not going to be able to get a good hand wash in because you're pulling your hands out of the water because it's too uncomfortable. Yeah, so water temperature doesn't matter, but the code says 85 degrees because apparently that's a magic number. Next slide, please. So that leads us to the next bit of my presentation, where I'm going to talk about this article. This is by John Boyce and myself. John is also the first author on that 2002 article from MMWR. I will say, in the interest of full disclosure, this work was funded by Gojo, the company where Jim used to work. This was funded by them when Jim used to work there. But John and I, this work represents the opinions of John Boyce and myself, and not the opinions of Gojo, although they did provide the resources needed for us to do the work. And again, I encourage everybody, if you haven't read it, take a look at this article, but I'm going to breeze through now in the next few slides some of the quick take-home messages from the article. Next slide, Jen. So the food code says wash, but people don't wash. Well, let's see what the literature says. So there's 4 articles that we reviewed in Boyce and Schaffner, published between 2004 and 2010. And basically, these studies all use what's called notational analysis, where they watch people or they videotape people and they later reviewed what they did. And they looked at, for these different sectors, catering, food worker, retail food service, and retail deli, how many times someone would have to wash their hands to be in compliance with the code. And you can see that those numbers range anywhere from 8.6 times an hour to 38 times an hour, with a mean of 13 times an hour. Now, if you think about it, well, you're supposed to be washing your hands for at least 20 seconds. You've got to stop what you're doing from wherever you're doing it. You've got to walk to a hand wash sink. You've got to initiate the hand wash. You've got to also dry your hands. Then you've got to come back to whatever it was you were doing before that hand wash event was triggered. So one of the reasons why I think people don't wash their hands is because if they followed the FDA model code, they would be washing their hands almost constantly. But let me suggest to you that, in fact, people are not stupid. They want to follow the rules, but they're also not going to wash their hands 10 or 15 or 20 times an hour for a variety of reasons. They couldn't get their work done, but also, as Jim alluded to earlier, if you're washing your hands 20 times an hour, you're probably going to end up with chapped or otherwise uncomfortable hands. And so there's some real significant trade-offs here that I think the code encourages us to overlook with this mandate to wash your hands, what, in my opinion, is an unreasonable number of times per hour. Next slide, please. It gets even worse, because not only are people not washing their hands when they're supposed to, but they have a phenomenally poor success rate at actually washing their hands correctly according to what the code says. Now, again, this is a very detailed slide. There's a lot of information here. We've actually got another table in the same manuscript that explodes this data out into even more detail. But basically, what I want you to look at is that the attempted, so there's a couple of important columns here. The 3 rightmost columns: the attempted rate, the success rate, and then also I would say the soil status, because as Jim alluded to earlier, the degree of soiling you have on your hands may impact when you decide to wash your hands, and it certainly impacts what would be an appropriate method of cleaning or sanitizing your hands. So the attempted rate goes from 0 to 57%. I calculated the median here, or the central tendency. People basically attempt their hands about 25% of the time when they should, according to this data. The success rate is about 13%. So people, here's the thing, if what the food code suggests was essential for ensuring food safety, we're not ensuring food safety. I would submit to you that, in fact, people are not stupid, and they're only washing their hands when they really know that their hands are dirty or they need to do something about it. And they're simply ignoring the times in the code where it says to wash your hands, where they know intuitively that they don't really need to wash their hands. Now, again, that's my opinion, but certainly we can agree that the facts show that people are not washing their hands when the code says that they should. Next slide, please. All right, so what do we do about this? Well, Jim mentioned these compounds, which I will call hand sanitizers, which are called something else depending upon where you are in the world or whether you're reading the code. But often, believe it or not, these compounds work better than soap. And I'm going to take you through a bunch of different slides here that talk about all of this. The key thing, I mean, you can go to the articles, you can read the studies, but basically the key column to focus on is that rightmost column, which is the rank order of antimicrobial efficiency. And what you can see, let's just look at the top line: 70% ethanol is better than the next two things, and which are also better than plain soap. And so what you can see here, as you look down, quickly scan down this column, the tendency is alcohol-based hand sanitizers are on the left-hand side, which means more effective, and soaps tend to fall to the right. So these compounds are actually better in many cases than plain soap or even antimicrobial soap. Why? Well, I think it has a lot to do with technique. When you apply an alcohol-based hand sanitizer, you don't really care about your technique so much. As long as you're getting alcohol on your hands and you're covering your hands, the actual scrubbing technique matters a whole lot less, because it's simply the chemical action of that alcohol. Next slide, please. Oh, just go back for 1 second, Jim, if you would. So that previous slide, these are artificially contaminated hands. Now we're going to work through some different data that are presented in the literature that focus on other kinds of contaminated hands. Next slide, please. So these are healthcare studies, and these are natural contaminants. And so we are, in this case, we've not deliberately inoculated people's hands. We're looking at naturally contaminated methods. So again, you can dig into the details if you want by reading Boyce and Schaffner. But again, look at that rightmost column. Alcohol-based ABHRs, right, are generally more effective than plain soap. You just go down that column and you see that ABHS, boom, 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 all the way down, almost always more effective. Next slide, please. Now we're looking at non-healthcare situations, also looking at natural contaminants. Same story. ABHS, boom, boom, boom. It's right there. It's almost always the most effective, and soaps are almost always less effective. Next slide, please. Finally, or next, this is non-healthcare situations, artificial contaminants. We're also starting to look at the effect of soil load. And again, look at that rightmost column. Soaps are commonly on the right, which means less effective. ABHRs, or alcohol-based hand sanitizers, on the left, right? And so you can see, again, generally speaking, these are effective compounds. Now, it gets interesting when you start looking at the soil level and the impact that has. Again, we don't have time today to go into that. I encourage you to read these articles and certainly take a look at Boyce and Schaffner and the logic where we lay out these different alternatives. Next slide, please. All right,
Okay.
over to you, Jim.
Good. Well done, Don. You did just great on timing. I'm going to try to, in about 12 minutes or so, wrap us up with this new study. Happy to share this poster. This was presented at ID Week, which stands for Infectious Diseases Week. It was last month, and this is a healthcare-focused conference with majority of attendees, I would say, are infectious disease doctors like Dr. Boyce, Dr. Pate, et cetera. And what we did was look at the comparative efficacy. Don mentioned a lot of the past publications. They haven't been done recently. So a lot of those publications were from the 80s, 90s, maybe even earlier, early 2000s. And there's not much on more modern whole hand methods. So we looked at that here. I've got this poster. You obviously can't read this, but happy to share this out with you. I'm going to hit on some of the key highlights. First of all, the test method itself. So this was developed really by a group at Dial. I worked with a lot of these people up until 2002, and they were trying to develop a good, objective way to measure, with hand washes in particular, how many germs would be reduced from the hands and ways to differentiate between formulations, and then how many would be transferred to food. And they ended up landing on cantaloupe melon balls as the transfer agent for a variety of reasons. And then ASTM put this through the paces, this method. If you're not familiar with ASTM, American Society for Test Methods, a great organization with many smart members there that debate methods and test methods and then prove that it's reproducible and reliable in multiple controlled laboratory settings. So that's the method we used here. It got titled The Evaluation of Effectiveness of Hand Wash Formulations Using the Paper Towel Method of Hand Contamination. So we did this test at a contract clinical lab. Two of the employees are co-authors. They've run this study before. Really great lab. We followed a detailed protocol, and had a lot of controls. First of all, what did we measure? We measure the mean log reduction of E. coli. That's the non-pathogenic strain that's recommended in the ASTM method. So how much of that E. coli was reduced on hands and how much was transferred to food, in particular melon balls. We controlled the wash water temperature to 40 degrees C, so a little bit higher than what's the minimum in the food code, as Don mentioned, but still comfortable, plus or minus 2 degrees C. And then we controlled the flow rate, which I think fits within plumbing standards, maintain that at 4 liters per minute. We had 12 subjects total, 6 on one day. They all executed the test on the same day, February 14th and 15th earlier this year. I was there to monitor the study and work with the team there to make sure we controlled it. Hand washing and hand sanitizer, alcohol-based hand rubs. I'll talk about what we used in just a second, but we measured what was the average dose. We used typical wall-mounted touch-free delivery systems, and we measured the average of the dose for the hand wash was about 0.9 milliliters, which is pretty typical, a little bit on the higher side actually than what you'd see out there in US society. And the alcohol-based hand rub was about 1.3 milliliters, which is a little bit on the higher side as well. You'd probably see a range of 0.9 to 1.3 in typical alcohol-based hand rubs. And we had a clinician that monitored every panelist, their product application and usage. We used 20 seconds of scrub time per the food code, both for the alcohol-based hand rub and for the hand wash. And we prompted them to follow good techniques. So this was the technique that they followed. This is taken from the Hand Washing for Life NGO. With hand washing, wet, pre-rinse the hands, apply the soap, scrub palm to palm, front to back, claw to paw, interlocked, do your wrists, do your thumbs, rinse thoroughly. You want to get that soap off your hands because if you leave soap on your hands, typically it's going to be irritating to your skin, cause some skin damage, and then you dry with a paper towel. And then the alcohol-based hand rub, we used a normal alcohol-based hand rub like people would typically use, 1 dose. We also did the Sani Once hand wash, which is applied 2 doses of hand sanitizer. I've just done that. You go palm to palm, front to back, claw to paw, both hands, interlock to try to get your fingertips real well. Do your wrists just right at the top, bottom of the hand. Get the thumbs. So really getting the thumbs and the finger pads is really critical here. And then you take 1 paper towel. Your hands are probably still wet with those 2 doses. 1 paper towel, vigorously dry them. So this is a way to remove some organic soil from the hands. So let's look at the data now. Actually, one more on the method. Sorry, this is from the poster. The E. coli is in a broth. It's spread onto paper towel. The test subject places their hands on the paper towel, presses firmly. A clinician was here to guide them on that. And for 5 seconds, then there's the intervention. We had the hand sanitizer and the hand wash on a stand. We controlled the water temperature and the water flow rate. Had a simple kind of poster here for the test subjects. It was posted right behind the sink so they could see this, and the clinician was there prompting them to move through this and keeping things right on time. And I mean right on time. She was really in control. Then you use the glove juice technique on one hand. You measure how many germs are reduced, so you know how many are on at the beginning, how many are left after this hand hygiene intervention, in this case, hand washing or hand sanitizing. That's what gets you the log reduction. You take the other hand, put these melon balls in your hand, move them around in your hand for 15 seconds, I think, 15 or 20 seconds. And then to put the melon balls in a stomach or bag and plate them all out. We used a market-leading touchless faucet to provide the water. The hand wash was a typical food service market-leading hand wash from a wall-mounted touch-free automatic system. It was a non-antibacterial soap labeled as foaming lotion hand soap. It was foam, and hand sanitizer was a food service market leading alcohol-based hand rub, again from a touch-free dispenser. instant hand sanitizer. This one was on the higher side for alcohol, 85% alcohol, but any hand rub should perform alcohol-based hand sanitizer should perform similarly, and hand washes should perform similarly. And then the paper towel was again, from a touch-free, typical leading wall-mounted dispenser, was recycled paper towel and dispensed in 8-inch by 13-inch towels, which is pretty typical. Okay, now the results. And I'm going to go through these quickly. Luckily, it's not too complex. So we've got the hand wash, the alcohol-based hand rub, 1 dose, as you typically use them, be guided to use them. And then the Sani once procedure, which is 2 shots of the alcohol-based hand rub and the paper towel. And you end up right where I actually thought we would end up, but this is the data as it came out. Hand wash is good. You get a 3-log reduction on hands from doing that. The 1 dose of alcohol-based hand rub was significantly higher, about a 4-log reduction. And then if you did the 2 shots of alcohol-based hand rub with the paper towel, what's called the Sani once procedure, you get about a 5-log reduction. And then the transfer to melon balls is inversely proportional, because the more germs you've left on your hands, the more are going to get transferred to the melon balls. So it really makes sense. This is just a little different way with error bars to display the data. The blue bar is the log reduction. Higher is better in that case. So you see the hand wash is, again, I'm not trying to bash hand washing. It is very good and it's important, but it was not as good as the alcohol-based hand rub or the Sani once in this procedure. And you see with the orange bar, the transfer to the melon balls, lower is better in this case, and it's inversely proportional. So what's next? I've got a couple wrap-up slides here. Would be really nice to test the same hand wash at lower wash times. Most people really wash their hands about 1 to 5 seconds in the rubbing process. They don't follow 20 seconds. So getting more data on the wash time of impact would be good. It would be interesting to know, what if you use the hand wash and the alcohol-based hand rub back to back, as the food code only allows right now for alcohol-based hand rub. You can only use that without an exemption right after hand washing. It'd be nice to know how much germ removal you got from water by itself. And if you had a contaminated gloved hand, how much transfer you would get from that. A couple pieces of missing information. It would be nice to know how many germs are typically on food handlers and food service hands, both in restaurants and healthcare settings. What's the microbial burden on their hands and on surfaces that are frequently touched? It would be nice to even look more at compliance rates in food service and apply some of these targeted interventions to see if that improves hand hygiene compliance. The multimodal strategy that I mentioned could be applied in food service and probably could have an impact. Not a lot of data on that. Automated hand hygiene monitoring. There's more modern behavioral science techniques to try to prompt people to clean their hands more. There was a CDC study that I found recently. I've got the link here. It's posted on their website. And for restaurants, similar to what Don said, the compliance was 9 activities per hour, and people actually wash their hands about 2 to 3 times per hour. So about 20 to 30% compliance. And they claimed, the people that were in the study, that the barriers are the time pressure, sink accessibility, and no real pressure from management to wash their hands. And then lastly, this data would be really cool if it was applied into quantitative microbial risk assessment and risk models. So got 2 conclusion slides. I'll try to do that in 2 minutes. There are resources out there, in addition to Don and I, who are happy to try to help you out on your hand hygiene knowledge and intervention practices. There's the Food Code, GFSI. CDC has a really cool website under Clean Hands Count. It's targeted at healthcare in particular, but I think a lot of the information is just general good evidence-based information about hand hygiene. There's a lot of publications. We've hit on some of those. Academic experts, thought leaders, regulators. Industry has a lot of information and technical experts. So I encourage you to work with your hand hygiene providers of the products, but look at the data and check it carefully. It used to be that hand washing testing on hands would be done with 5 milliliters of soap, which is way more than people use in reality. But companies would often bury that in the fine print that they actually use 5 milliliters. So check the data when you get that data when you're evaluating products. And then lastly, the NGOs. There are some great ones out there. I mentioned Hand Washing for Life has a lot of great information on their website, and Stop Foodborne Illness. Just a couple of those. I'm sure there's others. So the key conclusions, this study that we just did supports the global body of evidence that promotes alcohol-based hand rub because it has significant advantages in hand hygiene settings and hand hygiene needs. Hand washing does provide substantial bacterial reduction, so that's good. However, an alcohol-based hand rub was superior, especially with the Sandy-Once procedure, and reducing germs and reducing transfer to food. I would advocate, and I think there'll be an issue at the next conference for food protection, to have the food code allow alcohol-based hand rubs to be used in appropriate situations where without having to hand wash first. So some of those situations might be if you're in a hurricane or other natural disaster and the water is compromised, you have to boil your water. Well, boiling your water for hand washing, it takes a lot of time, and you have a limited amount of water. It's just very impractical. Front of house places where food service workers are at, the hostesses, hosts, servers, bartenders, etc., and then outdoor events. This drives me crazy. Outdoor prepared foods at sporting events or street fairs. They're supposed to set up their own hand wash station, and it rarely happens. And if it does, it's not done with quality. And my last point is that hand hygiene really matters. The evidence is rock solid. It's important to risk reduction and infection prevention. And there are solutions out there. You can find them, and we should demand for improved guidance. All right, I want to thank everyone here. We're going to get into your questions. I do want to acknowledge the study co-authors, Kate and Chris Beausoleil are at the lab, David Buckley from Diversity, Stephen Lyon from Chick-fil-A, and James Marsden, formerly a Kansas State professor and Chipotle food safety leader. These are the sponsors: Hand Washing for Life, Chick-fil-A, Chicago Faucets, Diversity, which is now part of Solenis, Eagle Protect, and Gojo Industries. And you'll get our contact information when Carrie sends out the slides. We're happy to speak with you. All right. How'd we do on time? It's 12:42. I'm going to stop sharing.
Great. Thanks, Jim and Don. Excellent information. We have some questions already queued up. And if you have more questions, please put them in the Q&A, or you can raise your hand. So first, I want to start with a couple questions about the efficacy of these alcohol-based hand rubs. So first, how effective are they against non-enveloped viruses like norovirus?
It depends. The formulation really matters on norovirus. So we all know that norovirus is super hard to kill. Norovirus and hepatitis A are both non-envelope viruses, tough to kill. There are some formulations with published evidence that show that it will work with alcohol-based hand rubs, but the formulation does matter. Don, what would you say?
Well, so I've been keeping up with the questions in the Q&A and typing questions, and basically, yeah, same thing. Like conventionally formulated hand sanitizer does not work very well against norovirus, but you can tweak the formulation. Again, Gojo's behind a lot of that research. If you search for Leanne Jacobs, she's published a lot of that in collaboration with, I think almost all of it's in collaboration with Gojo. So there's a wealth of literature out there on these topics.
Great. And then also, I think you mentioned this in your presentation, but I think it bears repeating. Questions about alcohol-based sanitizers and their use when hands are highly soiled. You've got fat, grease, or debris. Can you clarify that?
Yeah, I answered this in the Q&A, but I'll answer it again here. If your hands have grease, you should wash your hands with soap, because soap is really good at getting rid of grease. Um, I mean, bottom line, if you have feces on your hand, you should use soap, because that's you. In that case, you want to remove the physical contaminants. That's Yeah, so don't think that alcohol-based hand sanitizer is going to work with grease on your hands. That's not what it's for, right? In my opinion.
And I think it's been found, I totally agree. And I think it's been found in healthcare that people clean their hands when they feel
Their
disgusting,
hands are
right? The
dirty.
grease
That's
on your
right.
hands is dirty. And if you see dirt on your hands, people just clean their hands. They wash their hands, I should say. So it just kind of naturally happens that people hand wash at the right time. And if you get it into the culture like it is in healthcare, alcohol-based hand rubs are convenient, fast, easier to do, less time consuming than hand washing.
Which would improve compliance.
Exactly.
And then a few questions about kind of next steps. People are asking, is this something that you're plan on giving evidence at CFP? And yeah, a little bit more about how you would go about, getting that information into actual practice.
You want me
Yeah.
to take that down? Or
Well, let me just I just typed a response as well. I think for better or worse, people talk about science proceeding one funeral at a time. Like, new ideas don't take root until the people that hold the old ideas are no longer doing science. And I think regulatory change is the same way. So there are people out there that are adamantly against using alcohol-based hand sanitizers in certain circumstances instead of soap. And I don't think no amount of science seems to be able to change the minds of these people. So at this point, I'm focusing on the science. We're getting the policy, changes where we can. But in my opinion, you have to play the long game. And eventually, the science will win out, but not right away.
we are specifically, I'm collaborating with Stephen Lyon to create an issue for CFP around this, and we'll have multiple co-submitters. Don won't be on that because he's on Council 3 at CFP. We are planning to publish this work. I've got the manuscript partially drafted, going after a Journal of Food Protection. So hopefully we'll get it into that journal in next year. We'll probably submit it first quarter of next year. And then we are trying to do more wash time testing. These studies are one of the reasons they're not so often done is they're fairly expensive. So that study I just went through was in the ballpark of $45,000. So we came up with a collaborative approach where people shared and split the costs, which is a nice way to do it. So I really welcome, if you're interested in studying something that you think works, or you want to learn more about it, and you can contribute some funding or point us in the right direction for funding, we would jump on that.
Great. And Daphne, let me know that we have someone with a raised hand. So Dr. Al, Daphne, if you could unmute Dr. Al, go ahead.
I did. Good morning, everyone, and thank you very much for taking my call. It's a great information. Thank you, Don and Jim.
Thank you.
I do have a comment here. This is great, again, great information, but using alcohol will, in my opinion, it will dry the skin, causing cracks, and then people try to stay away from it or try to avoid it. That's one. And two, from the bacteria or from the virus's point of view, they will develop resistance, in my opinion. And down the road, then it's going to be going to have new evolved bacteria and then different problem. Let me share with you what I did in my world, and maybe you can maybe you heard me saying this before, some of you, but I'm very true believer in using the ozone technology. I said ozone technology is number one. Ozone kills bacteria instantly when it gets to it. And number two, the bacteria or the viruses will not develop immunity to it. And number three, we can tie it right to the pipe, to the water pipe that coming into the hand washing sinks or prep sink. And then anytime that faucet is turned on, the generator is going, and then the sanitizing effect is going automatically. So I call it like not idiot proof, smart proof. So all the time, I mean, they're sanitizing their hand. I mean, you call it, anytime they touch that water, their hand is being sanitized, and the sink is being sanitized. The produce is being sanitized. So I use it as a killer step. And I'm speaking from experience. I've been having this situation applied in our restaurant. I'm with the Cheesecake Factory. So we have a generator in every kitchen since I joined the company, and we use this as a kill step, and we having great results. Just want to mention this, so this way maybe you can take a look at it. Thank you.
Yeah, and Jim is more qualified to answer than I, but I'm quicker off the starting block, so I'll go first. With respect to drying, yes, if you have an improperly formulated hand sanitizer, you will dry out your hands. If you're using a well-formulated one, there's compounds in there that stop your hands from drying. With respect to resistance, I think there's been some evidence, but those studies are flawed, and I know Jim and I would be happy to share some information about those. I would push back a little bit on your claim that it's not possible for organisms to develop resistance to ozone. I think bacteria are very clever, and they will develop resistance to whatever we throw at them eventually. But really, it comes down to when are you using it, and using it appropriately. And certainly, Al, I'm all in favor of technology. Anything that we can use. It's not like it's not like alcohol-based hand sanitizers are gonna solve all of our problems. I think we need an array of technologies and figure out which technologies work best in which circumstances.
And I would say, Al, thanks for your comments. Both ozone and alcohol have the advantage with resistance that they're not left behind. They're both rapidly acting on the hands or the produce, as you mentioned, with ozone, but it's not staying there like a quaternary ammonium compound lays around, and then the bacteria are in contact and they can develop resistance over time. So alcohol really doesn't have evidence to support that it'll drive resistance, and I don't think ozone will either. With skin irritation, it's a big myth, actually, that alcohol-based hand rub is irritating or drying to the skin. There's a really great study by John Boyce. He's the lead author in the late 90s, I think 1999. He studied with nurses in his hospital and measured the skin condition, and their skin actually got better when they intervened with alcohol-based hand rub. And it kind of makes sense. If you're washing your hands a lot, the hardest thing I've ever had to work on in my life is formulating a mild hand wash. It's really hard to remove the soils without removing the good stuff on your skin. So I would disagree with the alcohol-based hand rub is irritating. Don?
Yeah, I put my hand up because I had a question, and now I've forgotten the question. Oh, no, I know. There's a lot of discussion about norovirus. And here's the thing. The solution, yes, conventionally formulated alcohol-based hand sanitizers don't work against norovirus. But you know what also doesn't really work against norovirus is washing your hands. Someone who's sick with norovirus is shedding millions or billions of virus particles, and hand washing gives you about a 2-log reduction. So great, a billion, 2 logs less than a billion is still a really, really big number. And so I think if somebody has norovirus, I don't want them and FDA has risk assessments that show this, right? Even if you norovirus and you reassign them to non-food contacting tasks, they're still spreading norovirus throughout the facility. If somebody has norovirus, I don't want them anywhere near my food. I want them home with sick pay, convalescing, and when they're symptom-free. I mean, ideally when they're norovirus free, but at least symptom free, so they're not vomiting and spreading diarrhea all over the place. That's when I want them back in a facility. If somebody has norovirus, they can be the best hand washer in the world. They're still going to make people sick, in my opinion.
I agree.
Good. Well, thanks everyone. We still have a lot of questions we didn't get to, but feel free to reach out to our excellent presenters with those. And also be looking for our post-webinar email. That's going to include access to this recorded session, a PDF version of the presentation, and any additional resources the speaker would like to share. And I put a link in the chat. Please remember to check out the rest of our Fresh Take Fridays fall webinar series at afto.org. And with that, thank you both for a really great and engaging webinar. And yeah, happy Friday, everyone.
You're welcome, and
Thanks for the invitation, Carrie. We appreciate it.
Yeah, thank you.
Thanks.
Happy Thanksgiving, everyone.
Thank you, you too.
All right, bye-bye.